So let's talk about how to approach a case of seizures in the MRCP PACES examination. In the long clinical consultation, you would have 5 minutes outside to prepare, 15 minutes inside with the patient or surrogate to examine and take his history, and then 5 minutes with the examiners for the viva. If you're new here and you're just starting your preparation, I would like you to first watch the beginner's guide video to get an idea about the exam format and the marking scheme. Okay, so in the 5 minutes outside, you would have a scenario given. In this case, the presenting complaint would be seizures, fits, or jerking, abnormal jerking movements. There will be the name and age of the patient. They might give you the duration of symptom and any other associated symptom, and maybe the vitals of the patient. So I'll tell you how to effectively prepare while you're waiting outside. You would be given a pencil and a paper, and you'll be allowed to take this inside with you. So on the paper, you have to write down the biodata of the patient. So his name, age, the symptom, and the duration if given. In the vitals, if there's anything abnormal, write that down. Now, on the right side of the paper, write down in capital letters driving. So driving is very important in case of seizures. Your clinical judgment and patient welfare skill will depend on this. So it's very important to address driving and to stop it regardless of whether it's the first episode, recurrent episodes, provoked or unprovoked seizure. The duration would vary, but you have to stop driving regardless. The second thing you write is the job and impact. It's very important to know how the seizures are impacting his life and his job. Third thing would be pregnancy and pills. If it's a female of childbearing age, it's very important to address pregnancy because that would affect our choice of anti-epileptic drug, and if she's on any birth control pills, because that can affect the threshold of seizures and affect the efficacy of the anti-epileptic drugs. So again, you will write down the biodata, symptom duration, any associated symptoms, and any abnormal vitals. And on the right side, you'll write down driving, the job and its impact, pregnancy, and pills. On the bottom right corner, you will write down the things that you would like to examine. So in this case, general physical examination, a detailed neurological examination, especially the gait, and to write down fundoscopy that you will offer to the examiner in the end. Any other examination would be decided according to the history. So the history in seizures it differs from the conventional history taking in other cases. So let's see how to proceed. Okay, so this is a classification of the potential causes of seizures, and most of these are common in the PACES exam. So starting with the main CNS causes, you can then classify them as either vascular or infectious causes, or maybe metabolic causes. So in infectious causes, you can see there is meningitis or encephalitis or HIV-related infections. You can think about cryptosporidium, toxoplasmosis. And structural or organic causes such as strokes and traumas or any SOL. Metabolic causes like such as hypoglycemia, hyper and hyponatremia, magnesium and calcium abnormalities, or it could be CKD or hepatic encephalopathy. Some autoimmune causes would be multiple sclerosis and lupus erythematosus, and drug-related causes can be either, it could be that the patient is already epileptic and is not compliant to his anti-epileptic medication or at a subtherapeutic dose, or maybe he's taking an overdose of other drugs, or maybe recreational drugs such as cocaine or amphetamines, or it could be withdrawal of his drugs. He could also be an alcoholic, or it could manifest because of alcohol withdrawal. Some psychological causes or functional disorders, non-psychogenic epileptic seizures. So we have to consider that as well. And some genetic causes. The important ones are neurofibromatosis and tuberous sclerosis. So in the history taking, the history of seizures is taken in 3 parts. So what happened before the event, during the event, and what happened after the event, and if there were any eyewitnesses and what triggered it. So we'll talk about that in detail now. So again, the history taking template is available on the Instagram page of PACES Guide. The first 4 or 5 points are fixed in any case of LCC. So you'll start with, hello, my name is Dr. Riaz. I'm one of the doctors in the clinic today. May I confirm you're Mr. Ali and you're 40 years of age? We're here to talk about your health condition. I would like to ask you a few questions and then examine you afterwards. Would that be okay? So the patient will say, okay, he will give you the permission. And then you'll say, so I've gathered from your notes that you've been having some abnormal movements in your body. Is that right? Can you tell me more about it? And when he does so, he'll say one or two lines about the details of his symptoms. And then you have to express empathy. I'm sorry to hear about that. I'll try my best to help you out. So now that the fixed beginning is over, you can then proceed with a specific history of seizures. So you can start with the first thing is this the first time you're experiencing anything like this? So it can differentiate if these are recurrent seizures or if he's already epileptic. And then you can ask, do you have any non-health conditions that I should be aware of? He might mention that he's epileptic. Can I see your medications list, please? So they would have a list of medications if there are any. Okay, so you can get this out of the way early on instead of waiting for the past medical history, because in this case it's important to know. Okay, on to the specific part. Okay, so did anyone witness what happened? He might say yes. If he doesn't, you'll have to take what he says, what he recalls about the episode. In most cases, he would say yes, there was someone, and he narrated the whole episode to me, and then he'll tell you about it. Okay, so you can ask in the pre-event, you have to ask him, okay, before it happened, what were you doing at that time? Where were you? So it's important to know whether he was sitting, standing, if he was sleeping, if he was doing any physical strenuous activity. Then ask about any aura-like symptoms. You can ask, did you have any headache before it? Any dizziness? Any feeling of sickness or ill feeling? Any racing or pacing of your heart? Any flashes or floaters in front of your eyes? Were there any loud sounds or bright lights? So you'll ask about two triggers as well here. Okay, so this is the pre part of the event. During the event, you can then ask, okay, and then what happened? He might mention that he fell down, his legs gave way. You can ask, was there any weakness before this happened in your legs or any part of your face? Okay, during the event, you need to ask him, how long did it last? Okay, and then you'll ask, during this event, during this episode, uh, which part of your body was affected? Did you experience jerking in both your arms and legs or any specific part of your body? And he might tell you that. You need to ask him, was there any frothing from your mouth? And I'm sorry to ask you this, did you lose control of your bowels or bladder? So this will qualify whether this was an actual seizure. After it, you can mention, okay, so what happened then? Do you remember? Did you lose consciousness during this? After the event, did you wake up in the hospital? Did you seek any medical care? And after the event, were you able to recall what had happened? Were there any headaches or any weakness in any part of your body after it happened? Was there any problem with your speech? So these are the sequence of events, pre, during, and after the event. So these are very specific questions. You can ask about triggers separately as well. Did you have any recent raised body temperatures or bug infections? Were you sleeping properly and eating well? Okay, so next you can then ask about other symptoms. In this case, the CNS is the primary system involved. So you would have to ask, do you have any usual headaches, any problem with your vision, any hearing problems, any problem with your swallowing, any difficulty in swallowing, or any problem with your speech, any problem with walking or balance, any numbness or tingling in any part of your body, any weakness in any part of your body. So these would be CNS questions specifically. You can then ask about some constitutional symptoms. Do you have any raised body temperatures, any changes in your weight or appetite, any night sweats, or any lumps or bumps on your body? So in cases like lymphoma, you could expect some features like this, or in infectious causes, you would expect fever. Okay, so now you can review the other symptoms. The other symptoms would be in a head-to-toe manner, any chest pain, any chest discomfort, any cough, any difficulty in breathing, any tummy pain, any problem with your waterworks, any loose stools or hard stools, any joint pains, any tiredness, any rash on your skin, Now you can ask about, do you do well in school, and have you ever experienced any difficulty in your learning or in your school activities if the patient is young. So you can think about tuberous sclerosis that can manifest with learning difficulties. The next step, have you ever been hospitalized before? Do you take any herbal medications? Have you ever had any surgeries before? Do you have any family history of any health condition or any similar symptoms? And then go to the personal history. I'm sorry to ask you this, but do you smoke or have you ever smoked? If the patient is a smoker, you need to stop smoking. Tell him, have you ever considered quitting? Smoking can be injurious to health, and I would like you to consider quit smoking. And if you need any help, I can refer you to the smoking cessation services. Then, do you take any recreational drugs? And do you drink any alcohol? So the alcohol should not be stopped. It should be cut down if it exceeds the weekly limit. The weekly limit is 14 units for both males and females. Then ask, so what do you do for a living? So if he does, maybe he's a banker or maybe a salesman, ask, okay, how is it affecting your life and your job? And if it's affecting his life, his job, he might tell you so. Express empathy. I'm sorry to hear about that. Hopefully, by the end of our discussion, we will be able to reach to a diagnosis, and I could write you a medical note that you can show at your occupational health department. Would that be okay? And that is enough. So the patient might be a driver by profession, maybe a public transport. If he's not, the next step would be to ask about driving regardless. Do you drive? And then ask about what he drives. So may I ask, are you involved in public transport or do you drive your own car? And then you have to tell him that I'm sorry to tell you this, but you have to stop driving because it can be a safety risk for you and for other people. You have to inform the DBL and stop driving. He might ask you for how long. I'm sorry, it's a bit early to tell you, but it can range from 6 months to 12 months, and I'll be better able to guide you once you do some tests. Is that okay? So the patient will not probe you much in this case because these are reserved for the clinical communication cases. In the LCC, it would be that complicated. But just ask him to stop driving and inform the DBLA. If it's a female, do ask about pregnancy. May I ask if you're pregnant or do you have any children? Have you ever had any miscarriages? Are you on any birth control pills? Or are you planning on pregnancy? Do you have any regular or casual partner? And are you planning for pregnancy? So this is important here. You can ask about travel history. So have you traveled anywhere recently? And if they have, where did you go? And when did you travel? When did you come back? What kind of activities were you involved in there? Did you consume any street food? What kind of water you drank? Did you go for any lake swimming? You can ask these questions. Did you get your vaccinations before you went? So these are not really relevant here, but you can apply if you think it's relevant. So this is how you approach a case of seizures. After you're done, then comes the examination part, starting with the general physical, then examine the you can start with lower limbs, upper limbs, doesn't matter, whatever seems relevant at that point, or for the fundoscopy. And if it's something irrelevant, the examiners would stop you. So, okay, I'm going to cover a couple of more topics next. I've already covered diarrhea and back pain. I'll try to do fatigue and difficulty in swallowing next. But if you have any problem with any particular complaint or presenting complaint or symptom, please leave a comment. And if you have any other problems, please, you can leave me a DM on my Instagram. If you want one-on-one coaching for both LCC and communication, you can send me a DM. Thank you for listening.